So this was a real-world data survey that we did with patients that are patients and caregivers that are members of Belong, our application, which is the largest social network for patients with cancer and for their families. So what we did, we looked at the perspective of the patient from the point of view of their fatigue and how that influences their normal activities, the adherence to treatment, and how emotional steps are also affected by the fatigue in this circumstance. Yeah. I think that the emotional burden of patients, that they are fatigued, is huge, and it's very difficult because these patients, the more advanced their disease, the more fatigued they are, and that influences not just in their emotional side, but also in the well-being side. And from that point of view, they express it in many different ways, with anger, with tiredness, with worries, with depression, with anxiety, and all that comes in the survey. And we do have that data, which is very, very interesting. Yeah. Well, I think that was the greatest important point in this study. We had 505 patients that responded to the survey. This survey was in the app, and the patients just tapped on that, and we obtained the data and we then process it. So it's a digital patient-related outcome. And very interesting, it's you see that the patients with more advanced disease, advanced breast cancer, advanced myeloma patients, patients with advanced lung cancer, those are the patients that have more problems from that point of view. So they stop, they change, they skip the treatments because they're thinking, I need to regain my strength. I need to get a little bit better before I can go into the treatment. And that comes up in the app very, very clearly, in this survey, very clearly. One of the questions we asked them is to give us tips. What do they do from that point of view? And very interesting, the majority will say, well, they rest a little bit more during the day, they will change the foods, they will do some exercise. And that's very important because even in this Congress at ESMO 2018, there are two other presentations where, from French groups, I think, where patients with advanced lung cancer also said that exercise, moderate exercise, helps them also improving the quality of life. So that's something that it's very encouraging to see that what our patients are telling us is very much what others are reflecting in their studies. The key messages are that we cannot close our eyes to fatigue, and fatigue is a major side effect, and it's a very common side effect. And we as doctors sometimes do not pay much attention to that. We need to pay much more attention. We need to implement more strategies, better strategies, so that the patients do better, because it influences not just the well-being of the patient, but the outcomes of the patient by influencing the quality of life and by influencing the response to treatment. So I think much more work needs to be done in that regard.